Watching your animal when it's sleeping and watching its breathing can be super, super helpful. If we can catch something early like that, the goal is prevent these animals from needing the bigger things like hospitalization and aggressive sort of care to try to pull them through some sort of crisis.
The heart's a pump, so if it's not working properly or if it has holes in it, ultimately it can cause congestive heart failure.
If it's either backwards failure or forwards failure, so if it's backwards, you have fluid backing up somewhere into the lungs.
It's like they're drowning from the inside.
You can also have forward failure, so if you don't have enough output from the heart, that can lead to things like weakness or collapsing or fainting to happen as well.
Today, we have a very special guest, Dr. Mark Harmon. He is a board-certified veterinary cardiologist at Boundary Bay Veterinary Specialty Hospital. What about this one? What are the signs and symptoms of heart disease, and how would an owner know that it's getting worse?
So the symptoms of heart disease can be pretty vague. So it may be things like their activity is just not as good as normal, or they're slowing down. And sometimes it's easy to chalk that up to just getting older. And sometimes it is because they're getting older, or maybe they have arthritis or other issues going on. But sometimes it's because they have heart disease and they just can't tell us. So they can have these very vague signs that they're not feeling as good as they used to, or that their quality of life is changing a little bit. However, there is one thing in particular that owners can keep an eye on, and it's a weird thing that you probably wouldn't look at otherwise, but watching your animal when it's sleeping and watching its breathing can be super, super helpful. So at least taking some sort of mental picture of what they look like when they're sleeping. A normal dog or a cat, when they're sleeping, will have a breathing rate that's about 20 to 30 breaths per minute or less. And if you just count every time the chest goes down, that's fine. And again, we're looking at breaths per minute, and it should be 20 to 30 or less. Some animals are 8 breaths per minute, and that's fine. And some animals are 25, and that's fine. It just gives you some sort of ballpark idea of what is normal for them, so that if something starts to change, you can be like, hey, they're sleeping, but they're still kind of breathing hard. And that can be a very early sign of heart disease. And if we catch it at that standpoint, the goal of these is not only help alleviate any sort of breathing difficulty, because that can be very stressful, but the goal is prevent these animals from needing the bigger things like hospitalization and aggressive sort of care to try to pull them through some sort of crisis. So if we can catch something early like that, that can be super, super helpful. But again, if you just notice that something seems a little bit off with their activity, maybe they seem a little bit weaker than normal, those are all reasons to talk to your primary care veterinarian and have that discussion of, could this be heart disease? Is there anything that might suggest it's heart disease? And do we need to do some sort of further investigation into it?
For pets who have been diagnosed with some kind of heart problem, that might be a really good way for them to just keep a log and monitor the sleeping breathing rate.
Yeah, they're very, very helpful to look for trends and to help us out on that front. We tell everybody that when we're looking for signs of heart failure in general, especially left-sided heart failure, which would cause signs of breathing difficulty, that can be super, super helpful. I will say there's a little bit of a caveat. So say an owner has a cat that has fluid around their lungs, or what we call pleural effusion. The breathing rates are actually not as helpful in that situation as far as detecting if there's a problem. And so it may be that just when they get up and walk around, they seem to be breathing more, or maybe they're using their belly more than they normally would. And those are definitely situations where you still want to talk to your vets, because breathing rates at least are a little bit limited when we're talking about those circumstances. And that's going to be primarily cats. It's less commonly seen in dogs to get fluid around their lungs.
Yeah, that's very helpful to know. A lot of people might not know exactly what congestive heart failure is. Basically, the heart's a pump, right? So if it's not working properly, or if it has holes in it, they'll have a long period where they'll seem fine, and then suddenly they'll decompensate. Ultimately, it can cause fluid backup either into the lungs or around the lungs. It's like they're drowning from the inside. Did I explain that right?
Yeah, you did. The very simple way that we think about it is either backwards failure or forwards failure. So if it's backwards, you have fluid backing up somewhere, and so into the lungs and affecting breathing, or into the belly, causing their belly to be really distended. You can also have forward failure. So if you don't have enough output from the heart, so say the heart muscle is very weak, that can lead to things like weakness or collapsing or fainting to happen as well. So it depends on what's being affected, what signs you may see. But yeah, that's a great description.